Yes.
Could you talk to what would a typical, I know everybody's going to be different, but if I walked in and said, hi, I'm here, what's it going to look like? What is a session?
Oh,
How do you go through that?
what does a session look like? Typically, the user or patient comes in, jumps on the power plate. The power plate is a platform about this big around, about this tall. You step up on the platform. There's a rubber pad on the platform, so you want to take your shoes off because you want to engage all the muscles that control the toes so they can grip the pad. These are muscles that become deconditioned because even though we are animals that are designed to move rapidly over uneven surfaces, what do? We move slowly over surfaces that would flatten out. So we lose a lot of the conditioning that is supposed to be within our feet. So it's very important when you jump on the power plate, you begin to engage the neuromuscular process of the lower extremities, the feet begin to get engaged, and you do a warm-up protocol, which will last about a minute or a minute and a half. Squat, push-up. You'll also grab on to either the cables or the straps, depending on how conditioned you are, and engage neuromuscular firing all the way from the base of the skull with the trapezius muscle, the supporting muscles that control where the shoulder goes and protect the neck. Engage all those muscles, and then you move to biodensity and do the full biodensity protocol of the 4 movements. So maybe a few minutes on the power plate, maybe however many minutes on biodensity to go through that standard protocol.
What's the frequency of it? Is it
One time per week. Better than the gym, yes.
And you get to see me. Are the session times like, you said like you referenced 12 weeks? Is it a lifetime commitment? Is it something that, I mean, you know, you go and start 12 weeks and so maybe you don't have osteoporosis or any of this yet, or I mean, obviously
Sure.
you have some bone loss or, you know, but, so you go and get the bone density test, then you guys will read it? I mean, what do you see on the bone, if I got a bone density test and they tell me, I don't know.
When you get a DEXA scan, your physician will give you an interpretation of that DEXA scan. They're licensed to give you an interpretation of that DEXA scan. They're going to tell you if you're osteopenic, osteoporotic, or you have healthy bone. No matter what the answer is, everybody benefits from higher bone density. So think of this as a graph, and you start off in life with whatever your bone density is, and it comes up when you're around 20 or 30, and then it begins to drop. So let's say you're on the downward slope. If engaging in biodensity, you can bring it right back up to where it was in peak, or you can flatten that off, and you have a lot more time. So because it's the natural process, we can assume that when you build bone with this therapy back to, let's say, where it was when you were in your 30s, or maybe even not to that point, maybe even in your 40s, you've pushed off the deconditioning of bone that could be life-threatening. So if you engage in the therapy for 3 years, from a bone perspective, it may be good forever.
When you go to the gym and you start exercising, it's supposed to be a lifestyle change. So you implement it in your program on a regular basis.
Right. I would never tell anyone to stop exercising.
Right.
Right.
So I wouldn't stop exercising.
Right.
Because I do
Right.
enjoy it. But, you know, would this be something similar to that where it's a lifestyle change, it's something that you would monitor on a regular, you know, for duration? You said 3 years. I know one time you said 12-week program.
When you have an adaptation in your body, so think about something that we can see. Think about a suntan. It lasts for a period of time. You know, when I live in Chicago, there are definitely months that you don't want to go outside. My tan goes away. So as soon as it starts to get cold and I start getting the sun, there might be a period of time where I keep that change in skin color for a month, or something like that. But eventually, the lower dermal layers come forward, and it goes away. So every adaptation will stay for a period of time. Nothing's forever. But depending on the refresh rate of the cells in question, so your question, that adaptation can stay longer or shorter. So with certain exercises, there are adaptations that stay with you for longer. Osteogenic loading would be one that stays with an individual for a very long time. Maybe the longest of any exercise modality. So how long? It depends. It depends on the individual. It depends on their biochemistry. It depends on their diet. It depends on many factors. But by changing a tissue that regenerates itself so slowly, the adaptation will be of benefit for a long time.
So you think like the max loading would be anywhere from a year to a year and a half for bone density?
That's what we've seen. It's a great question. That's what we've seen in research. However, we've only done 1 year of research. So does that continue? I've seen in single other patients that have shown me their DEXA scans in different biodensity locations. Yes, that keeps going. Keep building bone density. We've even seen people who build bone density much higher than what's considered normal. That goes to where you want. You don't want to be at 0 is considered normal. So like when someone's -1 or -2, those are standard deviations beneath where they should be compared to a 30-year-old of their age. If you're, let's say, a standard deviation above, that is incredibly high bone density. So that means you're specifically not likely to fracture. You have sort of, I don't want to call it superhuman, but far beyond what would be considered normal.
Superhuman's good.
Superhuman's good. Good call. What else? Anything? You've been a fantastic audience.